I'm Dr. Roberto Oliveira, and if you've ever walked into a room and had the purpose of that trip vanish like steam, you're not alone. A lot of people over 50 tell me the same thing. Names that hide, a grocery list that dissolves the minute you reach the market, a sentence that refuses to finish. You worry, rightly, about what it means. Today, I want to explain one common, often reversible reason for those lapses, a vitamin your nerves need, and give you clear, practical steps you can try right away, while reminding you when it's time to see a clinician. Imagine the brain as a house full of electrical wiring. The neurons are the wires, carrying signals back and forth. Around many of those wires is a protective insulating sheath called myelin. Think of cable insulation that keeps the current flowing quickly and cleanly. Vitamin B12 plays a quiet but essential role in keeping that insulation healthy and helping neurotransmitters do their job. When B12 is low, signals can slow, messages muffled, memory becomes a flicker instead of a steady light. That is why some people notice slowed thinking, tip of the tongue moments, or trouble with short-term recall when B12 is inadequate. How does someone become low in B12? There are several ordinary, age-related reasons. As we get older, our stomachs often make less acid, and that acid helps release B12 from food. Certain medications and gastrointestinal conditions interfere with absorption. People who follow strict vegetarian or vegan diets may not get enough B12 from food unless they use fortified products or supplements. In short, eating patterns, digestion, and age can combine to create a deficit even when someone thinks they are eating well. When a patient sits across from me and says, "Doctor, I'm afraid I'm getting Alzheimer's," I slow down and listen. My first response is not alarm, but assessment. Dementia from neurodegenerative diseases is a real and serious possibility in some cases, but many memory complaints have different causes, B12 deficiency among them, that we can test for and address. I once treated a woman in her late 60s who had been convinced she was losing her mind. She described ordinary moments, the smell of her son's cologne and not remembering his name, misplacing the remote multiple times a day. Her family was tense. On examination and basic blood testing, we found low B12. After addressing the deficiency under medical supervision, she began to report small, encouraging gains. Fewer blanking moments, more confidence reaching for words. Improvements like these are not guaranteed for everyone, and they depend on the cause and how long a deficit has been present. But they show that not all memory worries are irreversible. The distinction matters because the approach changes. For suspected B12 deficiency, the right first step is testing. A simple blood draw can measure B12 levels and related markers. If levels are low, your clinician will discuss the best route of replacement for your situation. Oral supplements, sublingual forms, and in some cases, injections. Which is appropriate depends on the reason for the deficiency, whether it's reduced stomach acid, a medication interaction, or limited dietary intake, and that decision should be made with a professional. I never prescribe a blanket dose over a video or a conversation like this. I encourage assessment and individualized planning. Beyond B12, think of brain health as a garden you tend. Some plants need sunlight, some need water, some need pruning. Nutrients that support that garden include omega-3 fats, vitamin D, folate, zinc, and antioxidants found in colorful fruits and vegetables. Hydration matters for soil and cells alike. Sleep is the nightly restoration that allows pruning and growth. Movement, whether brisk walking or strength work, increases blood flow and helps deliver nutrients to your brain. Cognitive activity, reading, learning a new skill, engaged conversation, is the sunlight that keeps circuits resilient. Conversely, a diet heavy in ultra-processed foods, excess sugar, frequent fried foods, and heavy alcohol intake increases inflammation, which is not good for the garden. Now, for something immediately practical you can try in your kitchen, a simple morning smoothie that combines gentle sources of supportive nutrients, tastes good, and is easy to prepare. If you follow a vegetarian or vegan diet, use fortified plant milk and consider adding a source of B12 through fortified foods or a clinician-recommended supplement, do discuss this with your provider. Start with one ripe banana for creaminess and potassium. Add a cup of blueberries, fresh or frozen, for antioxidants and a pleasant tart-sweet balance. Tossing a handful of spinach for folate and a mild green flavor that disappears in the blender. Add 1 cup of plain yogurt or a fortified plant yogurt if you avoid dairy. Yogurt provides protein and can be a convenient source of B12 in animal-derived products, while fortified plant options carry added B12 when labeled so. If you tolerate dairy, a 1/4 cup of milk or fortified milk alternative helps with texture. Otherwise, use water or the plant milk. For omega-3 support, stir in 1 tablespoon of ground flaxseed or chia seeds. If you'd like a touch of warmth and flavor, a small knob of fresh ginger or a pinch of cinnamon brightens the profile. Blend with a cup of cold water or ice until smooth. Drink this in the morning, preferably before a heavy meal. It is not a substitute for medical evaluation or therapy, but it is a simple, nutrient-dense habit that fits into a brain-healthy pattern. If you are over 50 and follow a vegetarian or vegan pattern, I want to be clear. Fortified foods and supplements are often necessary because unfortified plant foods do not reliably contain B12. Ask your clinician about testing and about the most appropriate replacement route for you. For others, small daily habits like this smoothie, keeping well hydrated, aiming for 7 to 9 hours of sleep, and moving your body most days of the week add up over months to create measurable differences in clarity and energy. Let me be explicit about timelines. When we correct a B12 deficiency, some people notice improvement within weeks, others take months. The degree of recovery relates to how long the deficit was present and whether there are other coexisting issues. Research from major centers shows associations between correcting deficiencies and improved cognitive symptoms in many patients, but results vary. We must avoid promises of dramatic cures. What we can offer is careful evaluation, targeted correction, and a supportive lifestyle plan that maximizes the brain's capacity to recover. You may wonder about testing. Standard blood tests include B12 level and sometimes markers like methylmalonic acid or homocysteine to understand function. If your clinician suspects malabsorption, additional investigation may follow. If nervous symptoms are significant, such as numbness, balance problems, or mood changes, these should be reported promptly because they can suggest broader effects of deficiency or other conditions. I want to return to a conversation I had recently in the clinic because it illustrates how fear often sits behind the question. Doctor, a man in his early 70s, said, "I keep forgetting appointments. My daughter says I should stop driving. I'm terrified of what might come next." I told him what I always tell patients. Fear is a reasonable reaction, but fear without information does a disservice. First, we check the basics: blood work, review medications that can cloud thinking, assess sleep and mood. Sometimes addressing one modifiable factor, correcting a deficiency, adjusting a medicine, treating insomnia, brings the most immediate relief. For this gentleman, we found low B12 and sleep apnea that had gone untreated. Treating both under medical guidance gave him back small but meaningful pieces of autonomy. He could remember appointments more reliably and felt less anxious about leaving the house. There are practical red flags that merit prompt attention: a sudden or rapidly worsening decline in memory or function, new balance problems, pronounced numbness or weakness, or significant changes in mood and daily functioning should prompt urgent clinical review. Gradual intermittent forgetfulness that interferes with daily tasks deserves an assessment as well, but it is not a reason to panic. Many pathways lead to cognitive symptoms. B12 is one familiar, reversible branch. Let me summarize the steps I encourage my patients to take. First, notice and note. Keep a brief record of what you're forgetting, when it happens, and any patterns: medication timing, sleep quality, recent stressors. Second, schedule an appointment and ask your clinician for a basic evaluation that includes B12 testing. Third, while you wait or in parallel, adopt supportive habits. Hydrate well, prioritize regular sleep, move daily, reduce ultra-processed foods and excess alcohol, and add nutrient-dense meals like the morning smoothie I described. Fourth, if you follow a restrictive diet, bring up B12 specifically with your clinician and discuss fortified foods or supplementation. Fifth, be patient with recovery. Nervous system improvements can take weeks to months, and progress is often incremental. Throughout all this, remember that the brain is resilient. Calling it a garden wasn't an accident. With consistent care, many gardens recover their color. Small actions compound. A single corrected deficiency won't erase every memory misstep, but it can lift a fog and create room for further gains through sleep, movement, social engagement, and mental challenge. If you're thinking, I recognize those slips in myself, that's a good place to start. Recognition opens the door to action. Test, talk to a clinician, and consider gentle lifestyle shifts while you wait for assessment. If you have a loved one who is worried, share this information and help them arrange a visit. If you follow a vegetarian or vegan pattern, point this out specifically when you speak with your clinician so they can consider B12 testing and replacement options suited to your needs. I'll keep coming back to a single guiding principle: do no harm and pursue sensible, evidence-based steps. B12 is not a miracle cure for all memory problems, but it is a common, treatable contributor that deserves attention. In the clinic, I've seen the relief in people who regain small but essential parts of themselves. The laugh that returns when a name comes back, the confidence to go out again, the relief in a family conversation. Those are practical, real outcomes that matter. We still have more to cover: how tests are interpreted, when injections are favored over oral forms, and the specific lifestyle routines that boost absorption and long-term brain health. If this resonated with you, in the next segment, I'll walk through what the test results mean and what questions to ask your doctor so you can arrive at the appointment prepared and informed. For now, if you recognize these signs in your life, take the first step of scheduling a basic evaluation and consider starting the morning smoothie habit as part of a broader brain-healthy routine. I'll be with you through the next steps. When you sit down with your clinician, the conversation about tests and treatment should feel practical and collaborative. Here are the pieces you're likely to encounter and how to interpret them so you leave the visit prepared rather than worried. How the tests are read. Serum B12 total. This is the usual first test. Many labs flag values below a certain cutoff as low and values in an intermediate range as borderline. A clearly low value supports deficiency. A borderline value means the picture is less certain and further testing is often helpful. Methylmalonic acid, MMA. When B12 is truly lacking at the cellular level, MMA usually rises. An elevated MMA with a low or borderline serum B12 strengthens the case for true deficiency. Homocysteine. This can be elevated in B12 or folate deficiency. It's less specific than MMA, but still useful in the overall assessment. Holotranscobalamin, active B12. Some specialists use this as an early indicator of B12 available to tissues. Low active B12 supports deficiency even when total B12 looks borderline. Complete blood count, CBC, and mean corpuscular volume, MCV. Low B12 can cause macrocytosis, large red blood cells, and anemia, but normal blood counts do not exclude neurologic or cognitive symptoms from B12 deficiency. Putting results together. No single number tells the whole story. If your serum B12 is low and MMA is high, treatment is typically indicated. If serum B12 is borderline, but MMA and clinical symptoms are absent, your clinician may choose to monitor and address reversible contributors, medications, diet, sleep, first, or to give a trial of supplementation and recheck. If symptoms are concerning, new or progressive neurologic signs, balance problems, rapid memory decline, clinicians often act sooner rather than later. When injections are favored over oral therapy. Intramuscular IM B12 injections are often chosen when there is concern about absorption or when symptoms are severe. Pernicious anemia or documented lack of intrinsic factor. Significant bowel surgery, inflammatory bowel disease, or other causes of malabsorption. Severe neurologic symptoms, numbness, weakness, gait disturbance, where rapid repletion is desirable. When the patient cannot reliably take or absorb oral medication. Occasionally for those who prefer injections for adherence reasons. How oral supplements can work. High-dose oral B12, often 1,000 milligrams or more daily, can be effective even in people with imperfect absorption, because a small fraction of very large oral doses is absorbed by passive diffusion. For many with dietary insufficiency or mild absorption problems, a daily high-dose oral regimen restores levels and is convenient and inexpensive. Safety-wise, B12 has a wide margin of safety. Typical approaches clinicians use varies in practice. Injection regimens. A common pattern is 1,000 milligram IM frequently for the first week or month, then at longer intervals. For example, weekly for a month, then monthly. But exact schedules differ by clinician and patient needs. Oral regimens. Many clinicians recommend 1,000 to 2,000 milligrams daily for initial replacement when oral therapy is chosen. Always confirm the specific dose and schedule with your clinician. Regimens are individualized. What to expect after starting treatment. Hemologic signs, if present, often improve within a few weeks. Energy and anemia-related symptoms can lift relatively quickly. Neurologic and cognitive improvements may take months and may be incomplete if treatment is delayed. Early treatment improves the likelihood of recovery. If injections are used, some patients notice small functional gains within weeks. Larger improvements usually accumulate over months. Repeat testing is typically done in the weeks to months after starting therapy. Clinicians often recheck blood counts and B12 markers in 6 to 12 weeks, though timing varies. Common causes to explore with your clinician. Dietary insufficiency. Vegans and some vegetarians, fortified foods or supplements are essential. Pernicious anemia, autoimmune, may require lifelong parental therapy. Medications that interfere with absorption. Long-term metformin or acid-reducing drugs can contribute. Gastrointestinal conditions, gastric surgery, chronic gastritis, Crohn's disease. Chronic alcohol use, which can affect nutrition and absorption. Bringing this context to the appointment helps your clinician pick the best tests and treatment. Practical checklist for your visit. Bring or be ready to share. A brief symptom log, examples of memory slips, when they happen, whether they're getting worse. A current medication list, including over-the-counter and supplements. A short note about diet. Do you eat meat or animal products regularly? Any long periods of vegetarian/vegan eating? Any prior lab results you have access to. Questions you want answered. See suggested list below. Questions to ask your clinician. Do my symptoms and lab results point to B12 deficiency, and how certain are we? Do I need additional tests, MMA, homocysteine, intrinsic factor antibodies? Should I start injections or oral supplementation, and what regimen do you recommend? How soon should I expect to notice improvement, and how will we monitor progress? Could any of my medications be contributing, and should we adjust them? If my diet is the problem, what fortified foods or supplements do you recommend? If I need long-term therapy, what is the plan for follow-up? Everyday habits that help. Maintain a balanced diet with B12 sources if you eat animal products, or rely on fortified foods and reliable supplementation if you don't. Treat sleep problems, stay active, hydrate, and reduce excess alcohol. These support the brain's capacity to repair. Review medications with your clinician. Sometimes a simple medication adjustment and targeted supplementation together make a big difference. Stay socially and mentally engaged. Cognitive activity supports recovery and resilience alongside medical treatment. A few final practical notes. High-dose oral B12 is safe for most people. Nevertheless, coordinate with your clinician if you have complex medical issues. Don't wait to test if you or a loved one have new or progressing cognitive or neurologic symptoms. Early detection and treatment preserve options. Keep expectations realistic. Some changes come quickly, others slowly. Celebrate small gains, the regained confidence to drive again, the return of a name, fewer moments of disorientation are meaningful. If you leave the appointment with a plan, a set of tests, a clear supplementation schedule, and a follow-up date, you've already taken the most important step. The science supports action. Identify reversible causes, treat what's treatable, and pair medical care with daily habits that nourish the brain. The garden analogy still fits. Sometimes the soil needs one key nutrient, sometimes a pruning of habits, sometimes both. With steady care, many people recover enough clarity to move through their days with more ease. If this is your first step, you've chosen well. Notice, test, act, and be patient with the pace of recovery.